Does your cat have a swollen lip? If so, which lip are we talking about here? The upper lip or the lower lip? The location can give us clues about exactly what is going on with your cat. In this video, I'll chat about common causes, treatment options, and the bigger picture. Something that is known as the Eosinophilic Granuloma Complex, or EGC for short. Hi everyone, I am Dr. Oz. Let's begin with the lower lip. A swelling here can often pop up out of nowhere. And the most common cause is what is known as the eosinophilic granuloma, which is part of the eosinophilic granuloma complex group of conditions. More on that in a little bit. The appearance is pretty standard and classic. A small, white, pink, or red fern bump right in the middle of the lower lip. And even though the lower lip is a common location, it can also be found in the mouth, especially along the gums and palate. Why does this happen? Honestly, we rarely find a specific cause. I suspect insect and flea bites are behind many of them, even though I can't prove this. I commonly see this in my young cats that like to explore or get into things. If it only happens once and responds quickly to treatment, I don't worry too much and I have my diagnosis. Some cats get them more frequently, especially during the warmer months when bugs are more active. Many clients are aware that insects get into the home and often report that they noticed their cat chasing something the other day. These are treated the same, even though they are much more frequent than anyone would like. However, if the story fits, again, not ideal, but still manageable. But if your cat keeps getting them regularly throughout the year, I start to think about allergies to food, plastic, or anything your cat could be sensitive to. And at this point, we may be a bit more aggressive with diagnostics and treatment. Let's chat about the upper lip. When the swelling occurs in the upper lip, the story is a bit different. You may have heard of rodent ulcers or indolent ulcers. Both fall under the eosinophilic granuloma complex umbrella. These lesions look like giant sores or ulcers on the bottom of your cat's upper lip at the front of the mouth. They can appear thick, red, and sometimes hollowed out if the cells in the middle of the swelling start to die. When this happens, they can get infected, smell bad, and even bleed. These are much more dramatic than the eosinophilic granuloma on the lower lip. And once you see one, they are hard to forget, and sometimes the upper lip can be disfigured. And unlike the lower lip granuloma, they don't resolve quickly and treatment may be long-term. Because these cases are more serious, I generally recommend a full workup, not only to look for underlying causes, but to make sure your cat is otherwise healthy before committing to ongoing medications, typically in the form of steroids or immunosuppressive medications, and both of these medications do come with potential side effects. Eosinophilic Granuloma Complex, EGC. You probably have noticed I keep saying Eosinophilic Granuloma Complex. What is that exactly? Let's break it down. Let's start with the first word. The eosinophil is the allergic white blood cell that the body uses to fight off parasites. Just look at the eosinophil. Isn't it beautiful? Even though I am cat-oriented and a cat advocate, I still have to admit that some species have an even more beautiful eosinophil. Normally, the immune system calls the eosinophil in during its normal patrol of the body in response to a parasite. But in some cats, this normal body reaction becomes an overreaction, where the eosinophil releases inflammatory chemicals and an inflammatory reaction occurs, sometimes to benign stuff in the environment like dust and pollen. The second word, granuloma, simply means a cluster of inflammatory cells close together at one location that creates a bump or a swelling. An eosinophilic granuloma is a bump that is packed with a bunch of eosinophils. And the final word, complex, well, that's part of just being a cat. Cats do what they want, they don't play by the rules, and they don't make sense. Being a little more scientific, the word complex is used to describe the three main presentations of the disorder. The first are the eosinophilic granulomas, those firm bumps on the lower lip. The second are the indolent ulcers, those dramatic sores on the upper lips. And the third is something we haven't discussed yet, eosinophilic plaques. When this inflammation is not associated with the mouth, they are referred to as eosinophilic plaques, and they are commonly seen on the stomach and back legs. They are red, raised areas of inflamed skin that cats will often lick, rub, and bite. And just to confuse you more, sometimes they are referred to as linear granulomas. In all cases, when you call in a lot of eosinophils, you get the classic signs of an allergy: itchiness, swelling, redness, and inflammation. And depending on the location, there will be a different presentation. Hence the 3 different disorders that fall under the eosinophilic granuloma complex umbrella. So even though they're different, they're the same. And we really don't know why these occur except to say it's a hypersensitivity reaction or an allergic reaction to something in the environment. Along these lines, the top 2 considerations are fleas and an allergy. In all cases, flea prevention, allergy testing, and a hypoallergenic food trial might be recommended. A seasoned veterinarian can oftentimes recognize eosinophilic granuloma complex in all of its forms just by looking at it. However, sometimes we have to get a biopsy to confirm the diagnosis, especially if it's in the mouth, in the skin, isn't responding to treatment, or just looks unusual. If you are curious about how we diagnose bumps in cats, check out my video called "What's That Bump?" In all cases, treatment is usually in the form of a steroid like prednisolone or an immunosuppressive medication like Atopica. If you are using pred in a cat, make sure you are using prednisolone, not prednisone. Each cat will be a little different, and a treatment protocol will be tailored to your individual cat. And even though response to treatment can vary, most cats do very well, with some cats requiring lifelong treatment. You may be wondering about antihistamines. They won't work here. 2 different white blood cells, mast cells and basal cells, release histamines. Eosinophils do not. Could these bumps be anything else? Other common disorders like acne, dental disease, infection, injury, or trauma will typically have a different presentation. A detailed history and a thorough exam by your veterinarian can rule these out pretty quickly. One important note: even though these lesions can look scary, they are rarely cancerous. A positive response to treatment usually rules out cancer quickly. So if your cat has a swollen lip, it is likely part of the eosinophilic granuloma complex, an allergic or hypersensitive reaction that can show up on your cat's lips, in their mouth, and even on their skin. The good news is that most cats respond really well to treatment. If you enjoyed this video, make sure you like, subscribe, and comment. Thanks so much for watching, and I'll see you on my next video.